The collagen powder that you use, usually in your coffee or as a supplement, does nothing unless you understand this one thing I'm about to share with you. Full disclosure, I sell collagen powder, but there's something very specific about collagen powder that allows it to work for your bones, your tendons, your ligaments, your
This
discs,
anatomical
your
illustration depicts
cartilage,
how joint
your
support is provided
fascia,
by the surrounding
your
muscles.
skin,
These structures
and
stabilize the
your
joint
blood
and enable
vessels.
smooth
And
body
that
tissue,
is this.
composed of cells and
Collagen
extracellular
does not
matrix, is intricately
respond to
structured.
generic
This diagram
exercise.
reveals
Taking
Not
collagen
generic.
powder only works with mechanical inputs. I'm talking about very specific types of force put on your body at a certain speed, at a certain timing, or certain rest, depending on what tissue you're trying to build.
target tissues
The
include
bones
bone,
in your
muscle, and
body
subcutaneous
are
layers.
actually
Each has
electrical.
distinct structure.
And it's something very fascinating because every time you walk, or you move, or you activate your muscles, you are generating an electrical current. It's called a piezoelectric effect. Okay, what does that mean? It means that you're using certain pressure or squeezing movement to create electrical impulses. And what I'm building up to is it takes motion, mechanical movements, to activate the collagen that you are taking in your body. No motion, a sedentary lifestyle, the collagen is expensive urine. This is super interesting. If you take a bedridden hospital patient and you evaluate their bone density, you will see faster breakdown of their bone than you would see in outer space with an astronaut under zero gravity. Astronauts lose between 1 to 2% of their bone density every single month floating in space without gravity. Bedridden humans, which are very sedentary, lose that every single week. So, the lack of motion causes your body to decay at a very rapid rate. I remember the summer after my senior year in high school, I broke my lower leg. I needed it cast. So, I remember keeping the cast on for, I think it's like 4 to 5, maybe 6 weeks. And of course, I kept my lower calf immobilized. In fact, I remember taking off the cast, looking at my leg, going, "What the heck is that?" Like there's no calf left. All the muscle that I had in my calf was completely shriveled up to nothing. That's because I had no mechanical motion to electrically stimulate the collagen within the muscle and the joints as well. And this is what people with arthritis need to know. Arthritis causes pain when you put your joint in a certain range of motion. And so, the body is telling you, don't move, stay still. So, pain is a really big barrier in maintaining the amount of collagen that stays in your connective tissue, joints, ligaments, and cartilage. It's truly a double-edged sword because pain prevents the motion and the lack of motion prevents the rebuilding and healing of the joint. But the most deadly version of this is prolonged sitting. Now, what I'm describing is myself. For years, I had all sorts of joint problems, and I didn't move my joints. Then I ended up with all sorts of arthritis. So, it forced me to look outside the box to come up with something that I'm going to share with you a little bit later. But talk about prolonged sitting. I was a poster child. I would get up in the morning early at 4 ru and sit at my desk until probably 5 ru or 6 noon or maybe 7 noon, and then I would get on my bike and go exercise. But that was not enough. Now, the reason I'm bringing all this up is because people think they could just take some collagen and fix their joints. It's not going to work. You need both collagen and the mechanical inputs to tell the collagen what to do. Now, if you have the mechanical inputs, like exercise without the collagen, that doesn't work either. So you need the raw material, collagen, and you need to know the specific mechanical things to build out the different tissues. And that's what we're going to get into next. So think of that like this. Collagen is the bricks, and motion is the person who lays the bricks and says where the bricks go. I'll give you one last point before I get into this. An average person is deficient in collagen because 30% of all of our protein is collagen. And usually, when you're consuming collagen in the diet, an average person might get between 1 and 3% of that. An average person is deficient between 7 and 10 gDs of collagen every single day. People don't eat the skin on chicken or fish. They like tender meat, so they just don't get the collagen. So, this is why a lot of people are doing the collagen powder. But we need very specific types of mechanical stimulation to create effects on the different tissues. And you really don't even need a gym or hours of exercise every single day. You just need to know the specific mechanical inputs to affect the different tissues in the body. If you wanted to create bone, this is a specific force that you'd want to do. Short bursts of exercise, a longer workout with lots of rest. Bones need more weight-bearing loads, heavier loads, especially because most people lose the bone in the lower back and hip area. And that's the last place you want to fracture. Also, if you did 5 to 10 powerful jumps few times a week, you're going to be sending the specific information into the bone structure to tell the body to make solid bones. And just as a side note, you need vitamin K2 with magnesium to make solid bones. Now, what about tendons? What's a tendon? A tendon is a connection between your muscle and a bone. The best way to build up tendons is through no motion, but put your tendons under force like 30 to 40 seconds of isometric holds. Isometric is contracting without motion. So, for example, let's take the Achilles tendon that's attached to your calf and your heel. So, if you were to do a toe raise and hold that contraction for 30-40 seconds, that would help strengthen that tendon. Also, eccentric type of contraction. Eccentric motions are when you're elongating a muscle. If you wanted to strengthen the tendons that are connected to your tricep, you'd want to lift up on a pull-up bar and slowly let yourself down, elongating the tricep muscle, creating an eccentric type force on those tendons. So, a lot of people ask me, what supplements do I recommend? Now, of course, I'm not biased of my own high-quality supplement line, but if you go to Amazon and type Dr. Berg supplements, you'll find more information. So, now let's move to ligaments. What's a ligament? So, if you're looking at the knee joint right here, if you had a connection between these two bones, that's called a ligament. One of the best ways to strengthen ligaments is standing on one foot with your eyes closed. The ligaments respond to unpredictability, and then they respond by becoming stronger. Also, another thing with the ligaments is bringing the joint to the end range of motion. Like, for example, if I was going to take my neck to extension all the way and then resist going this way, I'm going to strengthen my ligaments because I'm going to add some force at the end of the range of motion. I have a dynamite video in the description below explaining how to remodel the joints using this right here. Let's move on to your discs. Now, the discs are in the back, right through here, that connect the different spinal segments. So we want to create kind of a compression and elongation on that spine. And one way you can do it is by hanging on something creating your body weight distraction. You can also do an inversion table where you're lying upside down. I have 2 different inversion tables. It creates a pumping action for the disc. You could do flexion and extension type exercises for the spine. Super important. All of these unique mechanical inputs tell collagen to go to the disc and heal it. If your environment is off, everything else struggles. It's like a fish tank. Pollute the water, and the fish gets sick. You could feed them the best food, you can treat every single symptom, but if the water stays toxic, nothing recovers. The body runs on 10 signals like insulin, cortisol, inflammation, sleep quality, gut function. Every one of them affects how you feel. But there is always one signal that is more broken than the rest. And until you fix that one, everything else stays stuck. I built a free 2-minute quiz that finds it for you. It tells you which one of the main signals is holding your body back right now. Click the link in the description, take the quiz, and stop guessing. All right, now let's go to cartilage. Did you realize that you can remodel this stuff if you know how using certain mechanical motions? So, daily walking is very important because The thing about cartilage, there's no blood supply either, so you have to keep motion in it. But this is really the key right here, end range of motion against resistance. But again, if someone has arthritis or pain, they're not going to be able to go to the end range, and they'll never be able to remodel the joint, and it never rebuilds. So, we want intermittent resistance at the full range of motion in a given joint. So any stiffness or a lack of motion you have, you want to apply this to that. The best thing to rebuild cartilage is an intermittent pumping motion and bringing that joint to the full range of motion you can. All right, now let's get to fascia. Fascia is like the connective tissue that gives your whole body its shape. So, to strengthen your fascia, you need a lot of stretching in a twisting motion, an extension motion, a rotation motion, and that's called fascia stretching. Hanging, like by your arms, is super therapeutic. Bringing the joints to the end range of motion is super therapeutic to the fascia. So again, all these motions are the instructions to tell the collagen where it should go and where it should rebuild. All right, now let's get to skin. The skin responds more to stretch and motion, which has a lot to do with your emotion, right? Experiencing different emotions with your face, doing smiling exercises, different facial exercises. You know, allowing yourself to go through all of these different emotions, which, by the way, create motion in your face, and also chewing is super important. We consume soft food. You like tender steak, so we don't chew as much as we used to. And there's also a lot of people not very expressive with their face, so they don't activate the collagen on their face. So, one of the things with the skin, especially in your face, is you need to do daily exercises. I'm going to put some links down below if you haven't seen these yet. Also, regular exercise where you sweat, heat, like sauna, jacuzzi, with intermittent cold, super therapeutic to the skin. Now, let's go to the blood vessels. Blood vessels are mostly collagen, and what we are trying to do with the blood vessels is keep them elastic, keep them from becoming rigid. So, the best way to do it is to do a brisk walk for 10 minutes. Interval training, super important. Nasal breathing increases nitric oxide, which helps vasodilate or relax the blood vessels. In summary, you can see there's a lot of different motions that you need to put load or stress on the body to allow the collagen to be activated. The worst thing you can do in the world is be sedentary. The amount of collagen that I would recommend that an average person consume would be 15 g per day. Make sure you get the collagen that comes with vitamin C, because vitamin C is like a cofactor to allow collagen to work. I mean, even if you think about scurvy, which is a severe vitamin C deficiency, what happens in that condition with scurvy? They lose their connective tissue. So, vitamin C and connective tissue are hand in hand. And one additional tip that I would highly recommend is consume your collagen powder about 30 to 60 minutes before your big workout to maximize the effectiveness and the absorption of those amino acids. And taking collagen powder as a sedentary person not moving is basically just expensive urination. But in this next video, I'm going to dive into why a lack of collagen will cause you to age faster than anything else in this video right here. If this breakdown of how collagen and movement work together changed the way you think about your supplements and your daily routine, please subscribe and like the channel. We are uncovering the biological truths that have been hidden in plain sight. Let's strengthen your future together. The next health breakthrough will be shared here very soon.